I am Dr. G. Prasad Rao, a senior psychiatrist from Hyderabad, Asha Hospital. I am here to present a mental health program on trying to understand psychosis or the most fascinating disorder called schizophrenia. Schizophrenia literally means split mind. Schiz means split, freedom means mind. And this unique disorder affects 1% of population around the world, no matter whether you belong to rich or poor, whether you are educated or not educated, whether you are super intelligent or dumbered. This has not got nothing to do. And the uniqueness of this disorder over the 110 years or 20 years, the frequency of these disorders has not changed. And we scientists have a reason to believe that there are probably genes which can cause disease, but simultaneously there are genes which prevent this disorder from coming. Somehow this balance between pro and anti genes which leads to a balance of the brain. I would wish to talk to you what I learned over the years about this fascinating disorder called schizophrenia. Schizophrenia, the name was actually given by Bloiler, but prior to that, Emil Kraepelin, more than 110 years, had called this disorder as dementia praecox, or dementia occurring at a very young childhood. You know, dementia is a disorder of old age, but here the mental functions are deteriorated at a very young age. Ladies and gentlemen, this disorder, schizophrenia, actually starts very early. It starts around 14 to 20 years most commonly, and the frequency between 14 years and 25 years is roughly 40 to 50% of individuals develop during this age. Sadly, this is the time when the brain is growing. Sadly, this is the time where the adolescent's brain and the body grows, where an individual develops, as Isaac said, as a differentiation of dependency versus independency. That is, he starts becoming independent from his parents or family, having his own individual rights, temperament, value system. As he starts developing, those affected because of this disorder actually has a problem in identity. Schizophrenia is a disorder in which it occurs at a very crucial age, as we just now understood. But what actually happens is the mental functions, the identity, the individual starts losing touch with the reality. How? The most prominent symptoms which occur at this time is they first withdraw from the group. They withdraw in the school. They no longer are friendly with the family members. They no longer are friendly with the friends in the school. In fact, they start avoiding going to the school. During the early phase, they might have some symptoms which are akin to depression. They are not talking, they are not eating, but most importantly, their sleep is disturbed. As the few months or few days into the disorder, the individual starts developing a fear of unknown, a fear that something strange is going to happen to him, or he or she starts looking at the environment thinking that probably everyone is watching. If he lifts a finger, he thinks that somebody might say something bad about him. He starts getting a real wrong thoughts about his own perception, what he perceives in the environment. Also, his own self-concept is shattered to the extent that his own identity, he keeps questioning himself. This is a time when he starts hearing voices. Normally, everyone hears voices, but whenever some stimulus is there outside, but the peculiarity and the uniqueness in schizophrenia or a psychosis is they hear voices when nobody talks. Then where are the voices coming from? They're actually coming from his own brain. His own brain, the thoughts actually hears clearly. This is called auditory hallucinations. In fact, some schizophrenia individuals also are able to see some images live, some images like a ghost, whatever, something when nothing exists in the environment. This is called visual hallucinations. Some of the schizophrenia patients also have some bad smell coming. Only they smell the bad smell, whereas the rest of the family members, So uniquely what happens is all the family members say, no, there's nothing bad, it's only you are feeling like that. But in the real sense, a patient suffering from schizophrenia might have olfactory hallucination, or even some strange tastes he starts perceiving. When the food is commonly served for everyone, this unique patient who is suffering from schizophrenia would think that some bad taste, some raw taste, and each individual has his own way of putting the taste whenever the taste changes. So this is called change in perception. Then based on these voices, based on this visual, or based on his own disturbed thought process, he might start thinking that somebody is trying to harm him, somebody is trying to kill him. Or he would say that based on his educational background, he might say that his computer is being hacked, his computer is being fed with wrong information. He starts getting all kinds of disturbed thoughts. Some are unique to him. He would feel that he's changing into a female, or he's having and haunted by ghosts, or he would say that a cast black magic by somebody in the neighborhood. He would feel the teacher is specially targeting. Remember, this occurs between 15 to 20 years. If he is in the college, he would start believing that first he is not able to study properly, and the reason for that is because somebody has done some force and they're controlling his brain and mind. So these kind of uniqueness of symptoms are called positive symptoms of schizophrenia. But simultaneously, a patient suffering from schizophrenia also has so-called negative symptoms. What are these? Normally a child or an adolescent is full of energies. They have a lot of drives, they have a lot of hopes, there are a lot of dreams, positive dreams. They want to become this, they want to become a pilot, they want to become a police officer, they want to become a doctor or engineer or a space scientist. Their dreams are unmeasurable and unbountiful. But as the disorder comes, they suddenly become apathetic. They don't show any interest. I already told you they withdraw from the society, and they don't show even the minimal energy to take bath, lie down all the time. They withdraw to their rooms, and they are indulged, or they are made to indulge in some kind of a self-referential thinking process. The examples are that I'm being targeted, something is happening to me, that kind of a thought process, most prominently from the society to his own individual self. They are observed to be talking to self, they're observed to be laughing to self. Remember, they are in their own world. Whatever thoughts come, they react. So they keep talking and laughing to self. Mind you, ladies and gentlemen, all these things are symptoms of psychosis, and this psychosis is called schizophrenia. Especially if the individual talks about suspicion, they talk about paranoid schizophrenia. Ladies and gentlemen, along with this, depression symptoms do occur. Somebody frightened about this thought process or the auditory hallucinations or visual hallucinations might actually develop significant depression and attempt suicide. So these are the symptoms of schizophrenia. Mind you, if any individual for 4 to 8 weeks or up to 12 weeks, you find them just drifting from their normalcy, living alone, living uniquely, withdrawn, just think that the patient is suffering from psychosis at that point of time. And psychosis and schizophrenia are treatable. In fact, the modern medicines and modern psychotherapies and psychosocial treatments would help this individual to come out of the life. I'm going to discuss about the treatment in yet another program. Thank you for patient listening. This is what you are helping your friends and relatives, especially when you find some of them have these symptoms. The best thing you can do is refer them to a nearby psychiatrist, ask them to seek the help, and the psychiatrist along with psychologist will give the best quality of life and recovery to that particular person. Thank you, ladies and gentlemen. Namaste. I am Dr. G. Prasad Rao, a senior psychiatrist from Hyderabad.